What does the healthcare legislation mean to individuals?
Well, for individuals, the most profound impact is obviously to individuals who have no health care coverage. So it means that for tens of millions of people who are uninsured today, beginning in 2014, they will have access to health care, and health care that is not allowed to rate them in terms of any kind of pre-existing condition they have or any kind of medical history that they might have. If they refuse to purchase coverage, they will have to pay a penalty. So it's likely that the number of uninsured people in the United States will be drastically reduced as a result of this. For people with insurance, that means that they will likely be able to continue with their current benefit structure, with their current employer in most cases, or under Medicare or Medicaid or the VA system, whatever they're under. Although if you're with a private employer and your plan is perhaps very bare bones and doesn't meet the minimum standards of what's required under the Affordable Care Act, your coverage could be restructured. For some people, some businesses might decide, well, they don't want to pay coverage for their employees anymore. They will have to pay a penalty if they have 50 or more employees. Those individuals would then have to seek coverage in medical care or health care exchanges that will be established in every state. And this is where coverage will be available. All the coverage will provide coverage that at a minimum is directly associated with what is spelled out in the Affordable Care Act, but it's designed to be a competitive exchange. You might be an individual who is poor, for example, and you will be therefore covered under an expansion of the existing Medicaid program. The idea is to get virtually the entire population under the program so that no one will be without insurance unless they truly want to be. It also means that, at least to some extent, that coverage is now portable for the first time in the history of the United States. So many people work at jobs simply for the health care benefits. What this means is that if you move from one job to the next, you can be assured of either having health care coverage at that new employer or being able to buy it on an exchange, irrespective of any medical condition that you do have. But for individuals, does it mean that the cost of insurance is going to fall or drop or be dramatically lower? In most cases, no. I mean, healthcare costs are still expected to continue to rise. One of the major deficiencies of the Affordable Health Care Act is that it does not focus on containing healthcare costs. And the act can be revisited by Congress in the future, for instance, to institute medical malpractice reforms and other kinds of restraining measures on cost. But that will require subsequent acts of Congress.
Dr. Hartwig, thank you so much for joining us.
It's very much my pleasure to be here.
If you'd like to see more of my discussion with Dr. Hartwig, including his assessment of the healthcare legislation and what it means to individuals, businesses, and the insurance industry, view the other segments in our on-demand library.